Dr. Kari Leiting is a psychologist for the VA who helps veterans with PTSD, or post-traumatic stress disorder.
PTSD is a mental health condition that can occur after folks experience or witness a kind of life-threatening event, which can include things like combat, it can include things like physical or sexual assault, it can include natural disasters or serious car accidents like a car wreck or something like that.
Leiting says PTSD can cause negative reactions, and the symptoms can start right away but improve over time. However, there are others that PTSD remains or comes and goes, and she says certain events can reopen wounds.
So things like nightmares or memories, having emotional or physical reactions to kind of reminders of that trauma. It can then include symptoms like what we call kind of hyperarousal symptoms. So that is things like difficulty sleeping, increased irritability, feeling extra alert and on guard when you maybe don't need to be, startling really easily.
Leiting says those who have re-experiences may begin to avoid people or interests, or even turn to substance abuse to try and forget those memories. If someone or someone they know has a trauma, Leiting says they should at least talk to someone.
If you're noticing that within yourself and or noticing that in someone that you care about or that's important to you, it's worth mentioning it. It's worth having them maybe come and talk to somebody.
Leiting treats those who suffer from PTSD with 3 different psychotherapies, which all help process how the trauma affects the person and their life. One is called cognitive processing therapy.
So that's looking at kind of the way in which trauma impacted how you think about yourself, other people, the world, how it impacted kind of how you think about that trauma, and then you're going to spend time talking about that with your provider and doing kind of short writing exercises.
Leiting says while some people with PTSD may refuse to get help, she says seeking help can improve one's life and continue to move forward.
It's not so much trying to erase anything that happened or take away from those experiences or take away those memories, but can we find a way that the impact that trauma is having on your life right now be different than it is now? Can it be different in the future than it is now?